This is Margret. Margret is 76 years old and has had a bad fall in her home at 7:30 this morning when making her breakfast. Luckily for Margret, she was able to push her lifeline button to call for help. Her daughter Lisa received the call and rushed to her mother's home. Due to the severity of the fall, Lisa calls 911 and an ambulance arrived to bring Margret here to Alexandra Hospital. Margret will now undergo an assessment here in the triage area of the emergency department by a registered nurse. This assessment includes her vital signs using a vital signs monitor, her medication and medical history, which is entered into her electronic patient record, and healthcare undergoing optimization software system. Margret is now taken into a room in our emergency department and placed on a stretcher. Margret is cold, so a warm blanket is taken from the blanket warming cupboard and placed on her. A physician assesses Margret and orders an X-ray and blood tests. The physician stitches the cut on her head using the instruments sterilized and disinfected in the new autoclaves. Margret is now having an X-ray of her hip taken by an X-ray technologist with an X-ray machine, and she has an ECG taken with our ECG machine. A laboratory technician arrives to draw blood, and tests are performed on the following equipment: a centrifuge, a hematology analyzer, a chemistry testing instrument, and a coagulation tester. The physician will be able to view the test results on Margret's electronic patient record. The physician determines that Margret will need to be admitted here. A housekeeper is assigned to clean the room, which has just been vacated by a previous patient. The equipment used includes a swing machine, burnisher, and housekeeping cart. Margret is transferred to a patient bed in a room on the combined unit. Fortunately for Margret, she does not need the use of the patient lift for the transfer. She has a bedside table and an overbed table in her room. An IV, or an intravenous, has been initiated in her hand. The dietary department delivers her tray using a specialized cart for meal trays that keeps patient food warm. This does not include the costs of all the equipment in the kitchen that is used to prepare the food. Margret is now settled in for her healthcare journey to continue. This story of our fictional patient Margret is just a snapshot of some of the equipment that a patient encounters on their journey through the healthcare system here at Alexandra Hospital. The costs of the equipment Margret encountered on her journey total over $1.8 million. We rely on our community to donate funds to help us cover these costs. We are highlighting prices of equipment, as many do not realize that government funding does not cover these capital equipment expenditures. There are so many behind-the-scenes patient care equipment costs that go unnoticed. We need your support for Alexandra Hospital to provide exceptional care with the latest in healthcare technology. Please contact the Alexandra Hospital Foundation to make your donation today.